I'm back on live, and I was talking about dealing with emotional overwhelm, which many of us doctors have to deal with just based on how unique our jobs are. We are seeing about 20, 30, 40 patients, everyone with some medical condition, and we all know that a medical condition affects you emotionally, right? So the patient is in your office emotionally depleted or emotionally stressed up or tensed or probably overwhelmed, and you have to deal with that emotion. You need to handle the scenario, handle the situation, and handle the patient. And then the next thing, you're jumping into the next room or to the next bed, and the cycle continues. You're also dealing with all the bureaucratic bottlenecks and other medical team. And sometimes you really feel overwhelmed, particularly if you're a younger doctor taking instructions or orders from the senior doctor who isn't listening to you, or who is also very frustrated and is projecting their frustrations on you. The nurses, the pharmacy, the lab, everything. And then to top it up, the patients themselves are just not in the mood. Maybe there was traffic, they were delayed, you kept them waiting, or maybe you just have to break bad news. Just all that. And so what happens? You are emotionally overwhelmed. You feel really stressed out. And for many of us, the symptoms present in different ways. Sometimes you have a sympathetic overdrive. You're having palpitations, you're sweating, you start stuttering, you feel nauseous or you feel dizzy. For some, it brings on a bad migraine, some that have IBS. Just a lot of symptoms that rush at the same time that you have to. And it's really particularly common for females because of course we have our hormones as well. So how do we deal with when you feel that sense of emotional surge over your head and you feel you can't control yourself or control the situation anymore? The first thing is to breathe. I've learned that the breathing exercise is one thing we need to master, and that helps to regulate our sympathetic response. There's one where you're breathing deeply through your nose and hold it in until it stretches your lower diaphragm or even your belly if you can, and then you gradually bring it out through your mouth. So you breathe in and you do it as many times possible. You hold the breath for as much as you can before you release the breath out of your mouth. The other one is that you count, so you breathe in for 3 seconds and then you hold the breath for 3 seconds and then you release the breath after 3 seconds. Then you use 3 seconds to recoil and then start all over. So end of the day, you've drawn a complete square. That also helps to regulate your emotions when you feel the emotional overwhelm. Another thing you can do is that you can excuse me, I need to use the bathroom, I need to use the ladies. You excuse yourself and just go take a walk. Just take a walk. It might feel difficult, particularly if you're in a very tense situation, but honestly, it helps de-escalate. If you have to go cry at that time, it's okay. Go to the bathroom, cry, or go to a corner, but just go and release the tension. It helps. Just go. You don't have to talk to nobody, because sometimes if you go, you might end up venting and saying the wrong thing just based on how you feel. You just take a walk, just breathe in some fresh air. If you're in the building, step outside, let out some steam, feel better, and then come back to continue. I also encourage having a sugar high. Now, I know we're really careful about calories and diets, but I don't know what your sugar high can be. It can be a piece of fruit. It can be a little chocolate bar, just to give you that dopamine. That also helps. Drink some water. I want to tell you that the kind of jobs we do, it's high pressure, it's high tension. So definitely you will feel emotion, but handling the emotion with emotional intelligence is the best way to deal with the emotion. And so I want to encourage us to remember you're not alone. We all go through this experiences. It's part of being a woman in medicine, dealing with our emotions, dealing with our hormones, and dealing with the environment. But there are strategies and techniques that you can use to deal with the overwhelm. So let me know which ones you've used before and how it helps, and if you have any other techniques you can share. The breathing exercise, the stepping away from the situation and taking a walk, taking some fresh air, and getting a sugar high. Those 3 work for me good. I would come back some other time again to share some of my thoughts, but I just want to check in with us and see how we're doing. Have a good day. Bye bye.